So I'd like today to welcome Dr. Ziyad Mahfoud from the Medical Education Department at Weill Cornell, Qatar. He is Associate Professor of Population Health Sciences in the Division of Epidemiology. Today, the topic of our webinar session is going to be about Shisha and water pipe use among adolescents. And he's going to be providing us with insights from a researcher's personal experience in the Middle East. So Dr. Ziyad, welcome.
Thank you, Alia. Thank you for having me.
So let's kick off with the first question of today's session, which is, why do you think shisha smoking is popular amongst adolescents today?
I think there's a lot of factors. Some of these factors are related to actually introducing new tobacco to shisha. I mean, I don't know if people know this, but shisha if you want, the Middle East region used to be smoked only by older people, like my grandmother, my grandfather, with the regular tobacco. Now, with the introduction of these flavored tobacco, that also the emission of big smoke, it became very attractive to adolescents. And and that's one of the factors. There's other factors where actually, like in the cigarette smoking, the adolescents start thinking that by smoking shisha, they will be more cool, they give some more maturity to them. Add to that, there are false advertisements everywhere about, or for concepts about that shisha is healthy because it has fruits mixed with it. There's also the price of shisha. In the region here, the price is very cheap. And not only that, but you know, the shisha smoke sometimes shared with young people, they share it together. So also there's cost sharing if you want. So, and there are a couple of other factors that are very important, which is social acceptability. For example, in the region here, it's not acceptable for a woman to smoke cigarettes that much, except in a few countries. But it is very more acceptable for them to smoke shisha, even openly. Parents still, because of so many conceptions, they still think it's fine for their kids to smoke shisha. And then at the end, you can see in TV and in internationally or locally, a lot of actors and singings are taking pictures, smoking shisha, and athletes also. So, you know, adolescents get attracted to that and think it's okay to do that. So there's a lack of knowledge also about the health hazards of shisha among all these people.
Definitely very interesting information and insight. Moving on to the next question, what kind of interventions are you involved in to help curb this public health issue in particular?
Well, we have tried a school-based intervention in Lebanon and in Qatar. And the main aim of the intervention was to prevent or delay the initiation of smoking of shisha among 6th and 7th graders. Now, this intervention was based on 10 sessions. 5 of them were to increase the knowledge of the health hazards of shisha and other tobacco-related products. And also there are sessions for them to improve their resilience to peer pressure and also to give them different ways to think about alternatives of things to do or thinking about things to do than smoking shisha. And also there was sessions about false advertisement. And we looked at what we call a social promise, also one session where they promised they would not actually smoke shisha. Now, this was carried over 5 months during the school. These sessions were integrated into the school curriculum. And the results were, if you want, promising in the sense that we improved both in Lebanon and Qatar. There was improvement in knowledge about the health risks of shisha. There was a movement toward better attitudes against smoking shisha. And, but however, and we think maybe it's because due to so many other factors, that the initiation, there was not really, if you want, a significant difference in the initiation of tobacco use or shisha use among the intervention group and the control group.
Okay. I would assume from all these kind of interventions that you have, you're going to be kind of posed with a lot of difficulties and challenges. So what would you say are the, the highlighted difficulties you've experienced with such interventions?
Where there are few, if you want, that difficulties that we observed in both Lebanon and Qatar, where, when you deal with adolescents, you need the consent of the parents. We had, if you want, more than 50% of the parents did not even return the consent form. And from the other 50% who returned the consent form, only 20% accepted their kids actually be part of these interventions. So what we did is we collected data from those who rejected to be a part. We asked them, why are you rejecting your kids to be part of these interventions? And also we did some qualitative research, phone interviews with a few parents who are parents of boys and parents of girls, and from those actually in public and private school. What we found is that a lot of them gave similar reasons, whether it was the qualitative or the quantitative part of the research, is that the timing was not correct. Sometimes they said, my kid didn't want to be part of this research. And sometimes they wanted to shield the kid because they said, we live in a smoke-free environment. They also mentioned that the communication with the parent should be direct, not through the school. And then because they are not used to the research, if you want, research environment. So this was the first time that they got research. Some of them talked about gender issues, that they said shisha is more relevant to males than females, so they would not allow their girl to be part of this. Some of them said, we don't want to expose our kids because we didn't get very detailed information about the intervention. And you know that we wanted to get saliva in order to look at the cotinine levels. Some of them did not like that, but it was very minimal in that. There's also other issues when implementing this in school, integrated during the curriculum. You have to work really hard with the other teachers and in order to have the correct time so that you get these actually sessions done in a very good way. In Lebanon, we had few issues with the infrastructures where sometimes the electricity cuts or there's equipment lacking and things like this. And of course, we also looked at some social factors. For example, some of these kids, when they go on school trips, they might see their teachers smoking shisha. And that doesn't help when these same teachers or other people are telling them that this is not good. And probably some of these teachers are like role models to the adolescents. So it is a combination of a lot of factors that you always have to consider when you're doing this.
So yeah, you've touched upon, really interesting, you've touched upon the school system and implementing interventions in the school system. So could you explain to us in more detail the role of the school system, parents, governments in helping to improve the situation?
Yeah, I mean, I'll start with the parents. We have done few studies where we looked at the relationship between the parents and the adolescent kids and how that affects shisha smoking. Then definitely parents' behavior affects very much the behavior of kids in terms of shisha smoking. There are now even more literature that suggests that parents who smoke shisha, their kids are more likely to smoke shisha. Then other things that we also looked at, that positive involvement of parents in the life of their kids decreases all risky behaviors, especially also tobacco use. Now, so parents should take that into great consideration, be open with their kids, talk about the issues with their kids. have smoke-free environment in their houses, and so on. Now, in terms of the government, there are a lot of policies, that are put in order to protect the adolescents. For example, in Qatar, you cannot buy tobacco within maybe 1 or 2 miles from a school place. But again, the enforcement has to be there. Also smoking indoors is prohibited. And again, it's about the enforcement, the same with Lebanon. So these enforcement of policies, whether also inside the school, sometimes you might go to public schools where you find on a break a teacher smoking somewhere, maybe a cigarette or something. But again, these issues has to be very, very controlled, because kids actually learn from their teachers, learn from their parents. So school system should also be supportive in educating the kids about the health risks. They have to help in decreasing peer pressure and show students how to make better healthy decisions. Also, we started seeing that a lot of adolescents are wanting to quit. Some of them who actually are smoking, they want to quit, but they don't know where to go. So maybe start thinking about even giving them brochures. If not, they can provide cessation, but giving them brochures in order how they can get help, or maybe a hotline or something like that. So it has to be a collective effort from the government, I think the parents and the school, in order to make a change in a behavior. It's very difficult that you have to rely on one of them to make a change.
For sure, definitely. Very insightful, Dr. Ziyad. Thank you very much for joining us today. And I think that concludes our webinar today. Thank you.
Thank you. Thank you, Alia. Thank you very much.